Medical staff in Victoria were prepared for the worst to deal with the sick, with hundreds of people crammed together on a small freighter at sea for months. It turned out, though, only a handful of the migrants were taken to the hospital. And tonight, health authorities tell us the migrants are in good condition. Most of the patients who were admitted will be treated and discharged soon. Our Louise Hartland joins us now with that part of the story. Louise.
Hudson, the Vancouver Island Health Authority has been preparing for the migrants' arrival for months. Today, its first patients arrived. This is the only glimpse we got of one of the migrants arriving at Victoria General Hospital. After months at sea, passengers aboard the MV Sunsea are being assessed in Esquimalt, and those who need extra medical attention are being moved to Vic General. One by one, ambulances started arriving at 11 this morning, greeted by masked medical staff. Each ambulance and van carried one patient, with the exception of one, which carried two. In all, we counted 8 people coming in to be treated. The hospital has reopened the old emergency ward to provide screening, triage, assessment, diagnostics, and decontamination. VHA says patients who need to be admitted will be kept separately from non-migrant patients. Although they wouldn't go on camera, the Vancouver Island Health Authority says patients are being treated for nothing more than you would see at a normal walk-in clinic. And they say the people of Victoria have nothing to worry about. Esquimalt Wanda Fuca MP Keith Martin is a doctor and has spent a lot of time in developing countries overseas. He says the migrants will be in good hands in Canada.
And these individuals will receive top-notch and a thorough assessment by our physicians, nurses, and other caregivers here.
These 2 Tamil-speaking doctors have flown here from Ontario to volunteer to help. They both know the risks of having nearly 500 people in a small boat for months.
Tuberculosis is #1 concern. If there could be one active tuberculosis, it could be spread like wildfire. Gastrointestinal diseases, respiratory illnesses, and I'm not sure what's the sanitation there. But people can have all sorts of disease, including choleras.
Martin admits treating the migrants will come with a hefty price tag.
The cost of this, again, will be borne by Ottawa. It must be borne by Ottawa and not be borne by Vancouver Island Health Authority because these costs are deemed to associate with a national problem, but our local authorities cannot be the ones to be responsible for it.
But the cost of treating these migrants is the price you pay when you live in a country known to have a humanitarian heart. Now, VHA says the migrants at Victoria General Hospital will have no impact on services to the public. Hudson.
Louise Hartland reporting. Louise, thanks.